cancer. So, as you all about, the breast cancer is a common malignancy, mainly affects the woman. It is the second leading cause of death in women. An estimated of 203 lakhs 500 new cases of breast cancer, 2 lakh 3,500 new cases of breast cancer were diagnosed women in 2002, and 25 out of 35% of female cancers in all cities in India is breast cancer. And in India, one woman is diagnosed with breast cancer every 4 minutes, and one woman dies of breast cancer every 13 minutes in India. An estimated of 70,218 women died of breast cancer in India in the year 2012. And the breast cancer is a malignant cancerous growth, and mainly it affects the tissues of the breast. And cancer is a disease, you know, that abnormal cell growth that is in an uncontrolled way. Types of breast cancer, there are two types, non-invasive and invasive. So as the word implies, the non-invasive is it will be painless. The two types of non-invasive breast cancer are ductal carcinoma in situ and lobular carcinoma in situ. And invasive breast cancer, that is which is causing pain, that is infiltrating ductal carcinoma, infiltrating lobular carcinoma, medullary carcinoma, mucinous carcinoma, tubular carcinoma, and Peyer's disease. And coming to the non-invasive breast cancer, that is ductal carcinoma in situ, that is mainly characterized by proliferation of malignant cells, mainly arising from epithelial lining of the ducts. And in case lobular carcinoma, it will be arising from the lobules. And invasive, that is first one in invasive, that is infiltrating ductal carcinoma. Mainly this type of tumor arises from the duct system that invade the surrounding tissue. And in infiltrating lobular carcinoma arising from the lower epithelium, and mainly it causes the thickening of the breast size that 10 to 15%. And medullary carcinoma, tumor grow in a capsule inside the duct. And what is mucinous carcinoma? So mucinous carcinoma, will compare with other types, it usually grows very slowly, and this mucinous carcinoma mainly we can see in the post-menopausal woman. And tubular carcinoma is mainly caused due to metastasis after diagnosed with breast cancer. And Peyer's disease is a scaly lesion and burning and itching around the nipple or areola. So here the neoplasm is ductal, may be in situ alone or may also have invasive cancer cells. Here you can see the Peyer's disease, redness, scaling and flaking of the nipple, underlying invasive ductal carcinoma. Risk factors, early menarche, and early menarche, the child is attaining puberty below 12 years of age, and increasing age when the person is getting age, and there is a family history of breast cancer, lack of childbearing, and or breastfeeding, the woman those who are not breastfed the baby, and the late age of menopause, and alcohol intake, and dense breast tissue, or even the person is exposed to radiation. Etiology, again family history and the gene mutation playing a vital role, and late childbearing. If a woman has a first child after 35 years of age, early menstruation, so that is early puberty below 12 years, and late menopause after 50 to 55 years. And if the person is obese, obesity, increased density of breast, and the person is using oral contraceptives for a longer period, and the patient is undergoing any hormone replacement therapy after menopause, and even excess use of alcohol or tobacco. And coming to the pathophysiology, so actually it starts with a mutation, inactivate tumor suppressor gene. So what will happen? There is no controlling system of mutation. So and the cells will be getting proliferation, multiplies more, and the mutation will be inactive, and the DNA repair gene will occur, and the mutation of proto-oncogene creates an oncogene, and this all mutation will become inactive, and it will be producing a tumor cells. Finally, it will be causing a cancer cells. Signs and symptoms. So you can see the lump in the breast, and there is a changes in the breast size or shape. It will be enlarged, and skin dimpling will be there, nipple involution will be there, and you can feel the person will be having a spontaneous discharge from nipple that is will be reddish in color, and there may be changes in the texture of the skin and pain. Diagnosis. Diagnosis will be done by doing the breast self-examination. So we have to encourage all the people, those who are having risk factors, to do breast self-examination. That is manual examination. You can see the clockwise direction. With the fingertips close together, gently probe each breast in one of these three patterns. So you can see the diagram first. You have to examine the breast in the shower and examine the breast in the mirror with your arms down, up, and on your hips. And stand and press your fingers on your breast, working around the breast in a circular section. Lie down and repeat step. Squeeze you and nipples to check for discharge. Check under the nipple last. Mammography, it is a confirmative test for breast cancer. So mammography is a special type of low-powered X-ray technique, and it gives the detailed images of the internal structure of the breast. And even the high-resolution mammograph films demonstrate the microcalcification. And in case if you are seeing the mammography, each breast will be compressed horizontally, then obliquely, and an X-ray is taken of each position. And ultrasound is an adjunct modality that can be used in the assessment of a breast cancer. And its usefulness lies in its ability to distinguish solid from cystic lesion, because sometimes some cystic lesion also may be misunderstood like breast cancer. Other diagnostic measures, MRI imaging and FNAC, fine needle aspiration and cytology, core biopsy. Excisional biopsy will be done both for diagnostic purposes and treatment purposes. And serum tumor maker, that is CA153, CA27 and 29 and CA. Coming to the stages of breast cancer, so stages of the breast cancer will be done by TNM classification. The American Joint Committee on Cancer recommends this classification. So here we will see the tumor size. The TNM denotes the T stands for tumor size, N lymph nodes, and M metastasis. And in T1, the tumor size will be less than 2 centimeter. There will not be lymph node metastasis and no distant metastasis. And if the tumor size is 2 to 5 centimeter, metastasis will be ipsilateral, movable, axillary line, and distant metastasis occur. And the tumor size is above 5 centimeter, the metastasis to ipsilateral, fixed, axillary, and tumor extends to skin or chest wall. That is, metastasis will be occurring in the infraclavicular, supraclavicular, axillary, and all the other areas. And stage 0 is considered as a non-invasive carcinoma or carcinoma in situ. And stage 1 and 2, it denotes it's an early tumor. And stage 3 itself, it shows that it's an advanced stage. Tumor will be about 2 centimeter across and spread to underarm and lymph node, or its extension in underarm lymph node, or spread to near breastbone or other tissue near breast. And stage 4, the beyond breast, underlying arm, and the lymph node will be spread to other parts of the body. And the treatment, we will start with chemotherapy, that is the drugs which are used to decrease the multiplication of the cells. That is neoadjunctive chemotherapy, adjunctive chemotherapy, and chemotherapy for advanced metastatic disease. And the hormone chemotherapy drugs used to treat breast cancer, that is cyclophosphamide, methotrexate, 5-fluorouracil, adriamycin, and taxotere, and CEF, cytoxan, Elines, FAC, 5-fluorouracil, adriamycin, and cytoxan. And the side effects, all of us are aware that there will be immunosuppression, GA disturbance will be there, anemia, fatigue, hair loss, infertility, peripheral neuropathy. So overall, the patient will be tired, and there will be loss of hair, insomnia, anorexia, and there may be a chance of vomiting or diarrhea. Radiation therapy, types of radiation therapy, external beam radiation therapy, brachytherapy, radioisotope therapy. And the side effects of radiotherapy also even same like chemotherapy, it may be acute or chronic. In acute stage, the patient may have the symptoms of nausea, vomiting, damage to epithelial cells, lymphedema or infertility, and in late there may be a chance of developing fibrosis of exposed tissue. Other exposed tissue also there may be a chance of fibrosis production and hair loss, dryness of mouth and eyes. Surgical management, lumpectomy, removal of the primary tumor with the margin, and in segmental mastectomy, we will be excise the mass along with some portion of breast tissue. And quadrectomy, we will be excise the affected quadrant of the entire breast tissue. And total mastectomy, it is a surgical removal of entire breast tissue, but lymphatic tissue and pectoral muscles are preserved. So what is radical mastectomy? So here we will excise the complete breast tissue, including the pectoral muscles, axillary lymph nodes, associated skin and subcutaneous tissue. And it is mainly performed for advanced last stage of breast cancer, has involved the muscle wall under the breast tissue. And in modical radical mastectomy, we will excise the entire breast, fascia over the chest muscle and axillary lymph nodes, pectoral muscles remains in. And what is breast reconstruction surgery? So it is an integral part of modern day breast cancer management. So various techniques we are using. So that is mainly we will be advised the patient once that surgical scar is healed. It will be taking 6 months to 1 year after undergoing the surgical treatment. So there are various techniques out there: silicone implant, latissimus dorsal, myocutaneous flap, or gluteal free flap. Nursing management, we have to explain the patient about the breast cancer and the treatment option, and we should reassure the patient and reduce the fear and anxiety and improve the coping abilities, promote decision making abilities, provide routine pre op post-op care, and teach about the post-mastectomy exercises, prevent complications like lymphedema, infection and recurrence, provide pain medication, reconstructive surgeries and rehabilitation. And here assessment, we should assess the personal characteristics of the patient and the nursing diagnosis, health status, functional status, educational status, resources available and personal preferences, and we have to plan to decide the treatment, fragmentation of the care, and we have to assess the complications and whether the patient is able to do self-care, ability to utilize the resources, and we should reassure the patient. So all the things we have to implement by via education, we have to counsel the patient, give emotional support, advocacy, coordinate, and further referral interaction. In evaluation, we should monitor the progress of implementation and the benefit of the patient, and always try to maintain a good nurse-patient relationship. Coming to the nursing diagnosis, anxiety related to diagnosis of breast cancer, collaborative problem, potential for metastasis, and in anticipatory grieving related to loss of the breast and possible or impending death, and acute pain related to tumor compression or nerve ending, disturbed sleep pattern related to pain and anxiety, disturbed body image related to loss of a body part, sexual dysfunction related to body image or self-esteem disturbance. Coming to the dietary management. So eat omega-3 fatty acids, eat soy products, eat cruciferous vegetables, and prevention of breast cancer, get screened for breast cancer regularly, control weight and do regular exercise, know your family history of breast cancer, limit the amount of alcohol, avoid induced abortions, and avoid unnecessary medical radiation exposure, preventive mastectomy. Summary, so far we have seen the definition of breast cancer, risk factor types, signs and symptoms, diagnosis, treatment, and thank you.